One, we are live now.
All right, so here we are in the next session at the New York Black Health Matters Virtual Summit. Thank you very much once again for staying with us and participating throughout the day. It's an incredible opportunity to learn more about health issues within the African American community. We're going to talk now about sickle cell disease. Approximately 100,000 Americans are affected by sickle cell disease, but 1 in 13 African American babies are born with the sickle cell trait. So people with sickle cell disease have less access to comprehensive teen care than people with genetic disorders such as hemophilia and cystic fibrosis. So we'll take some time to discuss the issues of sickle cell disease, and we have two fantastic participants and presenters. Linda Bulone is a registered nurse with the Research Nurse Manager program at Queens Hospital Center, where she passionately advocates for the cell community, is active in the legislative efforts to expand funds for this community in New York. In addition, we have Gloria Rochester. She's the founder and president and CEO of the Queens Sickle Cell Advocate Network, Incorporated. She's a proud mother of 4, and one of her children was actually diagnosed with sickle cell disease at 18 months. She's a person who knows it well, is close, very, very close to issues at hand. Ladies, thank you once again for participating. Linda, it's all yours.
Great. So thank you, Colin, and thanks to all the organizers of doing Black Health Matters. I think that this is important and very timely at this point. And sickle cell disease is very important to discuss when we're talking about Black Health Matters, because there's a lot of legislative efforts now to expand services for sickle cell disease. I know Colin just went over the statistics, but there's even more statistics in New York that I think we need to know. So 10% of all of the nation's sickle cell patients reside in New York, and 85% of those are in the New York City area, which makes it important. I work at the Queens Hospital, which is part of the New York City Health and Hospital System, and it makes it more important for us to be involved in these legislative efforts and fight for the rights of sickle cell disease, which is predominantly affects the Black community. Before I start to talk about sickle cell disease, I just want to introduce Gloria Rochester and have her say a few words about herself and her experience and her organization. Her organization is extremely helpful in working with hospitals like mine and getting access to patients to the hospitals for treatment. So I just want to let Gloria say a few words, and then we'll talk collaboratively about sickle cell disease and what it is, how you get it, how does COVID actually affect sickle cell disease and treatment in this day and age, and where do we go from here? What can we do? What are the next steps? So Gloria, why don't you talk a little bit about yourself? Oops, did I lose Gloria? Okay, I think Gloria just got off. For some reason she may have pressed the wrong button. We're all pretty new at this Zoom situation, so you'll have to bear with us. So I'm going to talk a little bit about sickle cell disease and what it is. So sickle cell is a genetically inherited condition. People are born with it, and I'm going to talk about the genetics later and kind of use Gloria actually as a little example because she does have a daughter with it, and how in her family they inherited it. But what sickle cell disease is, it affects the red blood cells, and actually a portion of the red blood cells called the hemoglobin, which is a protein inside the red blood cells. And hemoglobin actually carries oxygen to all parts of the body. So the blood is transported through blood vessels. And throughout our body, we have blood vessels that go from our tippy toes to the top of our head. And we need that blood to flow freely and independently and happily. So when a normal red blood cell is normally disc shaped, it's shaped like a disc, it's very soft, it's like jelly, kind of goes through those blood vessels very freely. And a normal blood cell, hemoglobin cell, flows through for about, or lives for about 120 days. And then it's reproduced throughout the body in the bone marrow. And that's what a normal cell does. When a patient has sickle cell disease, they have a genetic defect that changes one amino acid called valine, switches it up with another part of glutaric acid, and that actually is enough to cause an abnormality in the cell and makes it into a sickle. The way it looks like a crescent-shaped moon, and it's actually hard. It's not as soft as a normal cell. It's actually hard like wood or hard like a rod, and it often gets stuck in the blood vessels. When this sickle cell gets stuck in the, oh, there she is, my darling is back. That's great. So I'm just talking about sickle cell, and then I'm going to get to you, and then we're going to talk a little bit about the inheritance of sickle cell. Is that okay, Gloria?
Sure, Linda, you take it away.
Okay, no, we need you. We need you.
Yes, I'm going to be here. Yes.
Okay, so anyway, the sickle cell gets stuck in the blood vessels. And whenever you have something, remember the blood vessels, they hold the red blood cell. So if you have that blood vessel getting stuck, what it causes is damage. That means that that organ that's attached to that blood vessel is not getting the oxygen, the nutrients that it needs to survive. It becomes very painful, that organ, and it affects every organ in the body. So this is, I like to think of it as, people think about this disease as a pain disease. And it's more than that, and they associate that with drug problems and drug addiction. But you know, in my personal opinion, you can't have use that negative connotation for someone with a real illness, a real disease, real pain crises. You have to use that designation with something that you know isn't associated with that. And when you have these crises, when you have this block of the blood vessel, that causes damage to the organ that's long-term. And a sickle cell patient has a lower life expectancy than a patient that doesn't have than someone who doesn't have sickle cell disease. So the average life expectancy has been 45 years old. With treatment, you can have people that live until 70, which is still a young age, even in this day and age when we're talking about people that live till 100. So we need a lot of work to do to treat patients with sickle cell disease. I'm going to turn this over to Gloria to give her a shot at talking about her organization. Her organization is very important to us because at Queens Hospital Center, we've developed a center that works directly with sickle cell patients to work with these pain crises and to work with stopping this end organ damage. We do this in partnership with Gloria's organization, and I think we all need to work together to decrease the pain crises. So Gloria, why don't you talk about yourself and talk about your daughter and how you became involved in this? Can you hear me, Gloria? It looks like I lost her again. I think I think she froze. Okay. Oh, she's coming back. Okay, so I'm going to say a little bit about the inheritance of sickle cell disease. Gloria is actually a good example because she has a daughter with sickle cell disease, with the actual disease. So when you have the actual disease, it means that both parents have what they call the sickle cell trait. They're carriers of disease, but they're not necessarily affected. Although some patients with the sickle cell trait can be affected, and I actually saw a patient last week who had quite a severe effect of the trait, but you have to have both parents who have the trait, and when they get together, both parents, there's a 25% chance that your child will get sickle cell disease. There's a 50% chance that your child could get the trait, just like mom and dad. And there's a 25% chance that they won't have anything at all, or any part of the trait. You know, Gloria has 4 children and she has the one child that has the disease. So she's kind of the perfect example of what happens and how it's inherited. However, it doesn't mean she could have had all 4 children with the disease. She could have had none of the children with the disease. Every time you have a new child, it doesn't take out your chances of getting the disease, the sickle cell disease. It starts all over again. It's like flipping a coin. If you flip tails, it doesn't mean that next time you get to flip heads, you could still flip tails the next time. So we have Gloria back, and I'm going to flip it on over to her before I lose her again. Do I still have you, Gloria, or did I lose you again? Gloria? Oh, I think I did lose her again. So let me see if there's something going on. Let me just see. Gloria got cut off again. Someone did ask a question about the trait. There is some talk out there that having the trait makes someone immune to malaria. That's kind of like an old wives' tale that doesn't necessarily, that's not true actually. Oh, there's Gloria again. Okay, Gloria, did I get you? Can you hear me?
Linda.
Okay, you got to start talking because I keep losing you.
Linda.
Okay, I think the audience wants to hear about your organization and how we work together, and maybe a little bit about your history and your family and how you became involved in your organization.
Well, good morning. Hello, everyone. Sorry about that. My technician here. My name is Gloria Rochester, and I'm the founder, president, and CEO of the New York State Sickle Cell Advocacy Network, Inc. We are the New York chapter of the National SCDAA of America. Yes, we do have a national chapter that oversees sickle cell all over the country. I, again, just want to thank Ms. Roslyn for doing such a beautiful job. She is the president, CEO, and the brain behind this Black Health Matters. I think about 2 years ago, she called me, or I called her, something to that.
Okay, I lost Gloria again. All right, so I guess I will speak. One of the things that happens with sickle cell disease is that it does affect different parts of the body because of this sickle shape. And it's really a oh, Gloria, you're back.
Yes, I'm back.
Okay.
Can you hear me?
Yes, we can hear you now. Don't touch anything.
No, nothing. Oh, my technician is right beside me. Yes. So like I said, we are based in New York. I live in New York, and the organization was started in New York to reach out to families and individuals with sickle cell. Remember, in the early 70s, you didn't hear anything about sickle cell. You didn't have any resources. We didn't have any information much on sickle cell because newborn screening just came in 75, I think it was. And because of the lack of knowledge, I had to get out there and learn about what is sickle cell. So we formed the organization, few parents of us, in my basement, New York, and we do clinical trials, work with clinical trials, which is the pharma, and also the hospitals, most of the hospitals. We started our Queens Hospital Center, we did with LIJ, and all over the state that we are, because people hear about your sickle cell and your organization. They looking for services and they want to know how can they get better acquaintance with us and what service do we provide for them. So I am not going to be talking too long because Linda already answered some of the questions. She talked about what is sickle cell, talk about the amount people that here in New York State that affected with sickle cell. And you know, we having challenges with no funding for sickle cell. So what I would leave everyone today, parent, individual with sickle cell, don't play. There's no funding out there for sickle cell. So we have to work very hard with the legislator, which is started from the city, the state, and the federal SCDAA work with the federal and the patient and the families. They need to hear from you about funding that you can have quality health care, access to quality care. So reach out to us. Our number is 718-712-0873. And again, we just changed our name from QScan, which is the New York State Sickle Cell Advocacy Network, Inc. Because for many years, we have the name of Queens, and people think we are just in Queens and we service Queens. No, we service all over. We have a system to say we don't close door on anyone. Anyone walk through the door or they look us up and they need services, we are going to give them. Because I put myself in their shoes. If I was out there looking for services, I'm going to come to you. And we do try our best here at the organization to provide excellent service for you. We have 2 social workers here, and we have our student, like one of my students is right here beside me, helping me with this. And it's beautiful services that we provide. Again, if I can't give it to you, I tell you right up front, I am going to research it and I'm going to get it for you because I put myself in your shoes. And please reach out to us. Again, the phone number is 718-712-0873. We have a program that we have in schools. We go to the different schools to talk about sickle cell and the 504 program. Because a lot of times our students are left behind because due to the fact that they're in and out the hospital a lot. That should not happen. You know, we want our sickle cell family to be doctors, lawyers, and whomever that they want to be. So we really work with the school faculty
and
help them. One of the things
that we're doing with you, Gloria, and we're doing with the hospitals is creating transition programs so that children and babies who are born with it, they grow up and they see their pediatricians who specialize in sickle cell, and they can transition to an adult program.
That's exactly right. Yes.
So we're working with the community organizations like yours, Queens Hospital. We have more of an adult program, And we're actually doing some programs with Jacobi Hospital as well, who has more of they have more pediatric patients, we have more adult patients. And so we're actually working together to, to try to transition these kids into adulthood so that they do it safely. Because sometimes they do feel very lost having sickle cell, being under the care of their pediatrician, and then going into the world of adulthood. And that's the importance of having specialized centers and being hooked up with organizations like yours so that they don't develop maladaptive behaviors, to treat their pain crises, that they get their pain crises treated by professionals and support programs that are specialized with sickle cell disease. And even during this COVID crisis, I know that people were talking about COVID. Because we have a specialized program, our nurse practitioner, Arturo, has been calling all of our patients during COVID, because patients can get acute chest syndrome. There's blood problems with COVID. I know we're talking about COVID throughout this Black Health Matters, but there are blood coagulation problems when you get COVID. So that actually makes sickle cell patients more susceptible to getting the more severe effects of COVID. So when you're hooked up in a specialized center like this, you can get that personalized care. You can talk to someone one-to-one. Whereas if you're not associated with a center and you're out there with sickle cell disease, you're kind of left with going into the emergency room during a crisis like this with COVID, and people were not letting you go into the emergency room. So we were able to monitor patients through telemedicine, and we have a collaborative effort with our Health and Hospitals Corporation, where we're doing what we call echo calls, where we're talking about our specialized cases. We had COVID calls, we had sickle cell calls, and all of our professionals were thinking about treating our patients in a very specialized, individualized manner. And Gloria was a big part of that. Unfortunately, we have a couple of minutes, and I do want to get to some of the questions. There are a lot of questions about how do you identify sickle cell disease. And we're lucky enough that in 1975, on newborn screening tests, all babies are tested for sickle cell disease and the sickle cell trait. So that's how you will know now that you have the sickle cell trait. Before that time period, women like Gloria didn't even know she had the trait. Is that correct, Gloria, that you didn't?
Correct.
Yeah, so, and she had 3 children because it's your youngest child who actually has sickle cell disease. So you had 3 children that didn't even know that they could be carriers or have
and
that.
even Linda, even my 9 months prenatal care, I was not, detect that I have the trait. My daughter was born, came out the hospital, rearing her at home, and later I found out something was wrong. When I took her to the doctor, they said, oh, nothing is wrong with her. She's maybe just hurt herself, put some compress and that will go away, and later the same thing happened. So I said, why this thing happened at the same place? And when I took her back, they said, no, I have to keep her overnight to do some testing on her. And that's when they told me the next day she has sickle cell disease, SS, the bad one. Children like that don't pass their 20th birthday. So, that was a shock for me. That was a hit in the head, So I had to go and learn it.
For the caregivers.
And remember, those days we didn't have internet, we didn't have Facebook, we didn't have, this kind of thing. We have to, not even brochures, that we have. So we come a long way. I took it that I have to go and learn what is it about my daughter. As a matter of fact, I think she's on the call also, so I'm not going to, but I'm talking about her because of she's a grown person. You know, this is what happened. And I'm really so proud of her because she gave me 3 beautiful grands. And now I'm a grandmother, great grandmother of 2 beautiful. So we have come a long way. So I want to tell everyone, please educate yourself out there. Please reach out to New York State Sickle Cell Advocacy Network. We have the answer here. And if we don't have the answer, we'll get it for you.
Yes.
And I just want to give a shout out to Atoro. Hi, Atoro. Atoro is a nurse practitioner at Queen's Hospital Center.
Yes.
Very lovely, work very well. All the patients are very, very pleased. Some of them is online right now. And we do have a support group that we have once a month. And please tell everyone about this beautiful center, the state of the heart that's here in Queens, New York.
Yes.
And beautiful, beautiful people. And
Yes.
a matter of fact, they cut down the rate of the emergency. There are lots of programs there for you to help yourself. So
Yes.
again, 718-712-0873. And we work very well. We work as a team. Linda and Atoro and the faculty work as a team.
Yes, we do. I think that at Queens Hospital Center, you know, Arturo is terrific. He's kind of the face of our sickle cell center, but our center really works very collaboratively. We are able to help patients not have to go into the emergency room to deal with sickle cell crisis. Before we had a program, we had a 65% rate of readmission of patients who go into crisis. So when we talk about readmission rate, you're talking about patients that go into the hospital and in 30 days of getting out of the hospital, they get readmitted. That's a very bad rate, and we needed to cut that down. We wanted patients to live more outside of the hospital and not inside of the hospital. That's how serious sickle cell is. We have very little time. I could go over every single disease site that it affects, but it affects your eyes because there's blood vessels in your eyes. Wherever there's a blood vessel, there's damage that could be caused by sickle cell disease. It could affect your bones. It could affect your kidneys and cause kidney damage. It could affect your spleen, and some people have to get their spleens removed. These are things that, you know, that need to have very specialized care and looked over very especially. Hello? Need to be looked over specialized. So we think that it's important for everyone to know that, and in legislation, they're trying to develop 8 specialized centers throughout New York State because of how severe this disease is and how it is in New York. And so, let me see how much time we have. Okay, I only have a couple of minutes. Someone asked me what made me get so involved in sickle cell disease. I'm actually happy. I'm a research nurse. I wasn't involved in sickle cell disease because unfortunately, there haven't been new medications developed for the past 100 years for sickle cell disease. And more recently, there has become more medications that are able to treat sickle cell disease. So as a research nurse, I wanted to help that effort for these patients in coming up with the most up-to-date medication. And I'm proud to say we were involved in 2 of the medications that just got FDA approved more recently, Voxelotor and crizanlizumab. Crizanlizumab helps it actually works by attacking the substance that makes the sickle cells sticky within the blood vessel, and Voxelotor actually increases the oxygen carrying capacity of the blood cell and, you know, stops you from having a low blood count. So those are 2 medications that have been developed. There is hydroxyurea, which does help the painful crises, and actually, even in terms of COVID, actually might have a protective effect against COVID for sickle cell patients. So that's one of the things that we're discovering. We're learning new things every day with COVID, and we're learning new things every day with sickle cell disease. So these are things that we are looking at, and people are doing studies finally on this disease, and it's getting better. And in the future, we're looking at gene replacement therapy. This is a genetically inherited disease. We should be looking at gene replacement therapy for sickle cell disease. They're, so these are some of the things that are happening. We only have a couple of minutes left. I don't want to take up time for our next speakers because this is such a thorough conference and really important to get all the information that you need. So if anyone has any questions, we'll try to answer them. Let me just see. Hold on a second. Now, someone asked, with the pandemic and children remotely attending school, what strategies are in place to spread the message? I think that this is one of the strategies in place to spread the message. I mean, I know that this conference was originally scheduled for March. It got canceled, but no one's going to stop this conference from happening because it's important, and it's important information. We're getting everything together. We're also practicing more telemedicine, and how does telemedicine fit into the treatment for sickle cell disease? We had a couple of patients who had COVID and sickle cell, and we were able to manage them by phone with our hematologist, Dr. Furman, and with Arturo Senza. We were able to do that. And so even though the patients could not come to the hospital, again, having a specialized center, if you know you have sickle cell disease, is the way to go, so that we can.
Someone asked for my number.
Yes.
Yes, and I want to speak on that also, touch a little bit on that for the remotely for the school online. SCDAA is putting out, they're working, the medical doctor, they're working on these kind of things. So if you call our center, I could give you the number, and also to have you added to the email and the newsletter that they send out, so you'll be well educated. Again, our number is 718-712-0873. And again, it's the New York State Sickle Cell Advocacy Network, Inc., and my name is Gloria Rochester. Please feel free to reach out to us. National and locally, we have a lot of information. National is working very, very, very hard to really capture the sickle cell community. So you got to be in it to really be part of that. Okay, thank you ever so much.
And I just want to give you my number to Queens Hospital Center also, because there may be people out there who are struggling with sickle cell disease and don't have a dedicated center, and maybe using the emergency room as a way to get treatment, but we want to prevent you guys from going to the emergency room. So it's Queens Hospital Center. You could call me directly and I'll get you to the right person and get you to an appointment. My number is 718-883-3751. It's not an operator, it's my direct number. So you'll get my answering machine and I will personally answer you back. And I will connect you to our wonderful staff who will handhold you through your treatment and keep you safe, both for COVID and sickle cell.
Again, thank you for this beautiful staff that put this thing together. Miss Roslyn and her beautiful staff. It's a pleasure working with you all, and we'll continue to work with you for the good work that you're doing out there in the community to bring Black Health Matters. It's not a better place as today to really sit and listen to this beautiful presentation that is given to you for everything. Thank you again. And looking forward to hearing from you all. We have a lot of stuff going on, so please reach us to us, 718-712-0873. The phone should be lighting up right now. And any question that we did not answer, we will answer them for you. Take care. All the best.
Yes, and I'm in my office too at 718-883-3751. 3751. So feel free to call us for treatment or for advice or for questions as well. Thank you.
Thank you ever so much.
Thank you.